Have you ever picked up a prescription for Viagra or Sildenafil and thought to yourself, how do I actually use this pill the right way? Maybe you've wondered how soon it works, how long it lasts, or what happens if you don't take it properly. The truth is, millions of men take this drug every year, but most are never told the finer details. And here's the surprising part. Many of the reasons Viagra doesn't work aren't about the drug itself, but about how and when you take it. I'm Dr. Jenny Carter, and in this video, I'm going to guide you step by step through everything you need to know about Viagra. How it works, who it's for, the safest way to take it, and even what to do if it doesn't seem to help you. And one of the points we'll cover could make the difference between disappointment and success. So stay with me until the end. So let's start with the basics. Viagra, or Sildenafil, is what's called a PDE5 inhibitor. That means it helps widen the blood vessels in your body, specifically in the penis, so more blood can flow in when you're sexually aroused. That increased flow is what makes it possible to get and maintain an erection. It sounds simple, but here's something you may not know. Viagra on its own doesn't trigger an erection. You still need sexual stimulation for it to work. That's why some men think it didn't do anything, when in reality, the body just wasn't in the right state for it to take effect. Now, before we continue, a quick note. If you'd like even more clear, science-backed insights into how medications affect your health, consider subscribing. I share practical, trustworthy advice just like this, and there's a lot more to come. Now, how common is this drug? Well, in the US alone, millions of prescriptions are written each year. Globally, it's one of the most widely recognized medications in history. Yet despite that popularity, studies show many men either take it incorrectly or give up too early when it doesn't work right away. And that's exactly why we're breaking this down today. Who is Viagra for? Generally, men over the age of 18 who have erectile dysfunction. But here's the catch. Not everyone can take it safely. If you've had a recent heart attack or stroke, if you suffer from serious heart disease or very low blood pressure, or if you take nitrate medications for chest pain, Viagra could be dangerous. The same goes if you've had certain liver problems or plan to mix it with recreational drugs like poppers. This is why it's so important to get it from your doctor or a trusted pharmacist, not from some unverified online seller. Counterfeit pills are everywhere, and they can contain anything, from the wrong dose to completely different substances. So how much should you take? For most men, the usual starting point is 50 milligrams. If that's too strong or causes side effects, your doctor might lower it to 25. If it's not effective enough, it can go up to 100. But here's the golden rule. Never more than one dose in 24 hours. Taking extra won't improve performance, but it can absolutely increase the risk of headaches, dizziness, heart strain, or dangerous drops in blood pressure. If you ever accidentally take too much, contact a doctor immediately. Now let's talk timing, because timing is everything with Viagra. It usually takes about 30 to 60 minutes to start working, but you can take it anywhere from half an hour to 4 hours before sexual activity. That means you actually have a fairly wide window of opportunity. But here's the insider tip. Take it on an empty stomach with a full glass of water. A heavy meal, especially one high in fat, can slow down absorption and leave you waiting longer than expected. And while it's fine to drink a little alcohol, too much can actually counteract Viagra by making it harder to get aroused. So how long does it last? On average, about 4 hours, though it can vary from person to person. Some men may feel effects fading after 2 hours, while others may still notice benefits up to 6. The key thing is that erections should go away naturally after sex. But if you ever have an erection lasting more than 4 hours, known as priapism, that's a medical emergency. Left untreated, it can cause permanent damage. Now let's get into side effects. Most are mild and temporary. Things like headaches, flushing, indigestion, nasal congestion, dizziness, or even some changes in vision. But there are rare, more serious effects you need to know. Sudden chest pain during sex, vision loss, hearing changes, seizures, or severe skin reactions. These are red flags that need urgent medical attention. They don't happen often, but knowing them gives you the power to act quickly if they do. But what if Viagra doesn't work for you? This is more common than people think, and it doesn't always mean the drug is useless. Sometimes it's about the dose. Sometimes it's about timing. Maybe you didn't wait long enough or waited too long. Other times it's about being relaxed and sexually stimulated. And in some cases, the body simply responds better to a different medication. The good news is there are alternatives. Other PDE5 inhibitors like Cialis or Levitra, and even non-pill treatments. So don't give up hope if Viagra doesn't deliver. And what about so-called natural Viagra supplements you see advertised online? The truth is, most of these products are unregulated, untested, and in some cases contaminated with harmful ingredients. They may be marketed as herbal or safe, but without proper testing, you really don't know what you're putting in your body. If you want to try an alternative, always do it through a licensed doctor who can guarantee its safety. At the end of the day, Viagra is one of the most effective treatments we have for erectile dysfunction, but its success depends on using it correctly, taking the right dose at the right time and under the right circumstances. When you do that, you give yourself the best possible chance of regaining confidence and control. Are you taking Cialis, Tadalafil for ED? What if you're taking it the wrong way, risking weaker results, wasted pills, or even dangerous side effects? For a crucial, expert-led guide on everything patients need to know, how it works, who it's for, the safest way to take it, and mistakes that sabotage results, watch my video, How and When to Take Cialis, Tadalafil. What patients need to know. It's essential for maximizing effectiveness and safety.